About 40% of Americans have made New Year's resolutions this year, and there are some really simple resolutions you can make that will have a great impact on your overall health and wellness, and most of them won't cost you a penny. Dr. Malika Marshall, Everyday Health's medical director, is joining us now with a list we can all live with. Dr. Marshall, it's great to have you here. Thanks for joining us.
Thank you, Tanya. Appreciate it.
So tell us a little bit. Everyday Health did a survey on what some of the most popular resolutions are. What did you find?
Okay, so when most people think of resolutions, they think of losing weight and exercising. But we at Everyday Health thought, wouldn't it be interesting to know what your doctor thinks you should resolve to do in the new year? And so we asked them. We asked doctors all over the country, what should your patients do? And so we came up with a top 12 list for 2012, and some of them are pretty obvious.
I love the first one, get more sleep. Who can argue with that? Sign me up.
That's right. So that made it in the top 12 list. You get 7 hours of sleep a night. And I know that's easier said than done for a lot of people out there, but we know that chronic sleep deprivation can lead to obesity and diabetes and heart disease and make you unproductive and cranky at work. So hard to do, I know, but we've got some great tips on everydayhealth.com that you can check out, and really important to have a good bedtime routine. Absolutely.
And now your second tip I also thought was interesting, because some people are on the fence about this. You say get that flu shot.
Get the flu shot. And it is not too late to get vaccinated this year. And I know there are people out there who say, I never get the flu, I don't need to get vaccinated. Let me tell you, if you do get the flu, you are going to rue the day that you did not get vaccinated.
That's true.
And people can die from it. So protect yourself, protect the people around you, and get your flu shot this year.
Absolutely. And you also say that if you're a woman, you should be doing your own monthly breast exam, correct?
That's right. I think a lot of us women forget to do that, and it really is important. You know, breast cancer is the second most common cancer among women, second to skin cancer. And there are plenty of ladies out there who have discovered their own breast cancers by identifying a lump in their breast. So good to do it every month, usually after your period, so your breasts are less tender and less full. And you can do it in the shower and make a habit of it and just examine, get to know your breasts, and not even just lumps. If you notice any dimpling or discoloration, you need to get it checked out.
Very, very good advice. Now, I love this next tip because it seems like something we would all enjoy doing. You say just simply spend more time with family and friends. That's good for your health.
It is really good for your health. And you know, in this day and age when we're all running around and there's so much hustle and bustle, we forget that FaceTime with people that are important to us is really, really crucial. So you might have to schedule an appointment like you would to see your hairdresser or your dentist with a good friend. My best friend and I have dinner every month, and we're really good about doing that, because having that emotional connection with other people can reduce your blood pressure, reduce your risk of depression and anxiety, help you live longer, and reduce your risk of dementia and other age-related changes. So.
Wow, it's incredible how helpful that can be, which kind of leads to one of your other tips, which is to give technology a rest once a week, right? One day a week, is that right?
One day a week, even a few hours a week if you can manage it. Put down your BlackBerry, your iPad, your iPhone, turn off the television, turn off the radio, and just have some quiet time to read, walk your dog, meditate, whatever you want to do.
Right.
But take time for yourself.
And you don't have to forego that morning cup of joe if you really love it like I do, right?
That's
okay?
Right. That's right. So caffeine, we always thought was so bad for you. It looks like it may not be that bad for you, and there may be some health benefits to drinking coffee.
I love it.
So you don't have to resolve to get rid of it. A couple of cups a day, as long as you're not pregnant, don't have underlying heart disease, is probably just fine.
Malika, thank you so much for all those wonderful tips.
Thanks for having me, Tanya.